What are some reasons someone might take methadone?
Methadone is a prescribed medication, usually for pain control, and it's used to treat addiction to opiates. It is also abused recreationally.
What is the classification of methadone?
Methadone is a narcotic. More specifically, it's an opiate.
How is methadone typically taken into the body?
Methadone is typically taken in a pill form. It's also injected into patients that have cancer. On the streets, it's usually snorted up the nose.
What are the side effects of methadone?
The long-term side effects of methadone is it causes brain damage, damage to the nerves, and liver damage. Some of the short-term effects of methadone are drowsiness, dry mouth, lightheadedness, urinary retention, constipation, irregular heartbeat, and tremors.
Is methadone addictive, and if it is, how?
Yes, it is addictive. It's in the same class of family as morphine, fentanyl, and heroin. It is both mentally and physically addictive.
How is an addiction to this drug treated?
An addiction to methadone is treated with methadone in some cases by slowly weaning people off of the methadone. There's also Suboxone, which is a combination of an opiate and naloxone to slowly to try to reduce the withdrawal symptoms. And the new one out there is the Vivitrol shot, which makes people physically ill when taking opiates.
When somebody stops using this drug, will they experience any withdrawal symptoms?
The person will experience heavy withdrawal symptoms. Some of these symptoms include a fast heart rate, hypertension, which is high blood pressure, symptoms of anxiety attacks, dilated pupils, which means that your pupils are big. They'll be sweaty, vomiting, diarrhea, uncontrollable yawning, seizures sometimes, rhinorrhea, which is a runny nose, and piloerection, which is where the hairs on your body stand on end, kind of like goosebumps. And those are just some of the withdrawal symptoms.
And lastly, do you have any closing statement?
Addiction to opioids is highly dangerous. There is a potential when taking methadone to advance to heavier opiates like heroin or fentanyl. Overdose to opiates is also dangerous. Some of the signs and symptoms of an opiate overdose are pinpoint pupils, cold, sweaty, pale skin, absence of breathing, and abnormal heart rate. If you see these signs in friends or family, make sure to call 911 immediately. Without fast treatment with naloxone, people will have permanent brain injury or die. If you know somebody who's addicted or you yourself are addicted, seek help as soon as possible. Be safe when you're out there. At a lot of these parties, friends are handing you stuff. You got the new pill parties now. Just be sure that you don't take any unknown substance. If you become addicted to opiates, it's going to be a long, hard battle to be able to get clean.